Yeah, let's do a review. Do you remember last time what we the knowledge, the piece of knowledge, anything remembered in your mind, in your big brain?
I remember we discussed about some pancreatic diseases, and then also, yeah, there was also something to do also with diabetes, if I remember. I mean, hypoglycemic states.
Diabetes.
Yeah. Those are the two major conditions that I remember. Yeah.
Okay. Anything else?
No, I just know.
Okay.
So,
Sure. Let's do a review about the questions. The first thing, what is hypoglycemia? It's a very big definition for us to remember. And then it's 2.8 millimole per liter, right? 2.8 millimole per liter. Let's remember this. And we have another definition for Whipple syndrome, which means insulinoma. Here, it means blood sugar less than 2.8 millimole, and then which means it's hypoglycemia. And then if you gave the sugar supplementation and the patient being fine, all of this process is called Whipple syndrome. Right? And we have a picture about this insulinoma, which means in the pancreas here, right? And beta cell. And we have tumor here. It's called insulinoma. And then how to treat it is to reduce the insulin, because this insulinoma continuously increase the insulin, which lower the blood sugar, and then we have to treat it to do the surgery or give the octreotide to reduce the insulin, right?
Yeah.
The second one is which part of the pancreas most common, sorry, what's that? Oh, good. Which part of the pancreas, another color here. Which part of the pancreas most common cause the tumor? This syncope and cold sweat in the morning, we know, and then it's already 3 years, we know is insulinoma. And then we have a pancreas here, and they say which part is the most common, and then we know it's tail. Oh, sorry, it's head. Which answer? I forgot the answer. A, B, C, D, E. E is the correct answer. Tail, body, head. Oh, here's the tail. Tail, body, head. Because it's small, they say it's the tail, right? Tail, most common, and then body and tail. And here head. Sorry, head. Most common part of the tumor. And insulinoma, what is insulinoma? You already say hypoglycemia syndrome, hungry, nervous, sweating, languid, confusion, coma, and Whipple triad. After we gave glucose, the symptom relieved, then we know it's Whipple triad. And do the blood test, we know it's low glucose, high insulin, high C-peptide, right? how to treat it? Surgical resection to remove the. Yes, this is that. Pancreatic cancer had body tell. Again, if it is cancer, malignant, it should be here the most common had body tell. But if it is tumor, insulinoma, it's benign. Benign tumor is tail, most common, and then body, and then head. It's so different. And then this one is asking us how to use the medicine to treat the antihypertensive drug. We have several different kinds of that, right? For example, ACE inhibitor, ARB, beta blocker, diuretic, calcium channel blocker, CCB. And this patient have type 2 diabetes also. They have like hypertension. Where is the hypertension? Here. It's more than 150, and then we know it's hypertension. And then they have urinary protein 2+, which means we know it already have the renal disease. Diabetes plus hypertension plus urinary disease, then we directly to choose which one. It's ACE inhibitor, ACEI and ARB. This is very important. How to find out the answer directly here and here. Then, and then number 4. Number 4 is fasting glucose 5.2. And we have several multiple drugs for this patient and diabetes many years. And then it's heart electric fraction, which means EF factor for it means the heart failure happened, because usually we need to more than 50, right? But this patient is 42. 42 means the heart already have a mild failure. So which medicine we need to stop now? Acapulco, insulin, ripaglinide, spleen, stagliptin, or this. And if we know to stop this one, because it may cause a little bit heart failure. This is just the knowledge you know, then you can choose it. If you don't know, you don't know which one. Very simple. Then pioglitazone, this one, cause cardiac inefficiency. Then we need to stop it. And then the number 5, they give insulin injection because the diabetes. And then blood sugar next day. In order to lower the fasting glucose blood sugar, how to do it? We give insulin, right? And then at least half an hour before meal. Blood sugar is very high 2 hours later after dinner, and then feel dizzy and hungry at night. Hungry at night, which means that in the midnight it will be very low, and the next day going to very high, which means here 10.2, extremely high in the morning. But very low, dizzy and hungry at night. Low and high, this is what Somogyi effect. Remember? This means in the night it's very extremely low, and then cause the patient to reactive, becoming high. And what we need to do is to reduce the insulin doses before the dinner. This is very important. If you don't know, you maybe think, it's high, then we just increase the insulin. If you increase the insulin at the midnight, it's still very low, and it will kill the patient because of low blood sugar. That's why we need to reduce the insulin and see the treatment. This is called Somogyi syndrome, Somogyi effect. At daytime, and lower in the 3 midnight, 3 a.m. and becoming upper in the morning. It's called somogi. The doctor named Somogi. The professor, the specialist Somogi created this effect. They named it by his name. And then, okay, this is all of them we solved last time. And then here. Oh, another one. Metformin, weight loss, low density lipoprotein. Then they say like which one to choose. BMI. Keyword here. BMI 30 is very body weight is very high, and how to lose the body weight. Metformin, another for diet drug, you know. It's very famous because if someone is just they don't have diabetes, but they just want to lose weight, someone take metformin. Have I ever heard? Yeah, it's true. But they have side effects because they cause something else, so need to be careful to take this one. But usually, if someone is they want to lose weight, they just buy this metformin and then take it. So because its BMI is high to lose body weight, also blood glucose is very high, then we gave metformin. Yeah, very simple knowledge. Okay, number 7. This is new. 7. Let me see. 7. Another 7. There should be 8, right? 7, 8. This should be 9, 10. Okay. In this PPT, we still left several. After we finish this one, and then we will see the new PPT I prepared yesterday. Right. Okay, let's see the number 7, right? Okay, please read it.
Okay. A male, 56 years old. Physical examination revealed that fasting blood glucose was 8 millimole per liter. 2 hours postprandial blood glucose was 18 millimole per liter, and serum glycerides 4.5 millimole per liter. Low density lipoprotein 3.1 millimole per liter. Weight loss 5 kilogram in 6 months. Physical examination reveals blood pressure 160 over 100 millimeter mercury, BMI 130 kilogram per meter square should be. No other normal conditions. The first choice of antihypertensive drugs is
captopril and nifedipine, diuretic, metoprolol, atropine. Atropine, of course not. Let's see which option. I give you like 30 seconds to think about it. Okay. High, it's high. So we know it's DM plus hypertension. Okay, hypertension. Which one to choose?
Actually, I'm not sure of which one to choose.
You know?
Wow. No, I'm not sure. It will just be guessing.
Okay. Nifedipine is CCB, you know? CCB means calcium channel blocker, you know that, right?
But which one will not, how can I say, will be best for somebody who is obese, having hyper, and still actually, help, especially in terms of glucose, and yeah.
Okay, so this case, we have a long case here, details about this patient. And then we know its fasting glucose is extremely high, and then 2 hours later, the glucose is higher, more high, right? That this one is not useful. We know it's obese, and then we lost blah blah. But the key word here is the hypertension the patient have, and then still we know this definitely is diabetes. So this information for this case is we know is diabetes and hypertension, and how to choose the anti-hypertensive drug, right? I think we already say like the last cases about here, they have diabetes and hypertension, and what we choose, do you remember?
It was something glio something. Wait
a minute. This is body and then no, ACE inhibitor here. They have a diabetes and also hypertension. What we choose ACE inhibitor and the ARB, right? And also this patient have another thing. Keyword is a renal protein 2+. We choose ACE inhibitor. Then for this question, which is ACE inhibitor? Which is here, captopril. Something end with Prewell. L here is ACE inhibitor. Then we choose A, the first one. Is it? You see, in this case, we consider diabetes combined hypertension, and we use insulin converting enzyme inhibitor, and you can resist. Captopril should be the first choice, which means ACEI. Just this simple. The number 2, nifedipine. Why we don't use nifedipine? Nifedipine is calcium channel blocker, CCB. If you read a lot about hypertension drug, you see nifedipine, you already know, oh, it's CCB. It's okay for hypertension in elderly, but not for this case. Diuretic, they can cause hyperglycemia, hyperlipidemia, so it's contradiction in the hypertension. So it's not okay for this case. Metoprolol is a beta blocker. Beta blocker is not effective against the hyperglycemia, hyperlipidemia. Already not okay. And the atropine is I'm calling receptor agonist, so increase the blood pressure, so it's not okay. Only one okay for this case is A, captopril. So it's for A, right? It's ACEI. Very simple, right?
Oh, thank you for the explanation. Yeah, it makes sense.
Yes, very interesting. So again, see this one. Angiotensin converting enzyme inhibitor ACEI is blah blah PRIL. So indication for this one is hypertension and diabetes. Next time you see hypertension and diabetes, you just choose ACEI. So another thing is contraindication: hypokalemia, pregnancy, renal artery stenosis, renal insufficiency is creatinine more than 265. You know, if the patient they have hypertension and the diabetes, next time already knows you just directly choose ACEI, but there is something tricky here. If the patient the K is very high, or this patient is pregnant, or they say renal stenosis or renal failure. Renal failure they have a data. If the creatinine is more than 265, you shouldn't use the ACEI. It's very tricky. Also, what's ACEI? The side effect is irritating the cough. Do you remember? ACEI causes the cough because the stimulate make patient cough a lot. They say like, so the cough is very annoying. Then you should choose the ARB. And also ACEI causes the angioedema. Angio, which means the vascular edema. The side effect is just not okay for the patient, then you should choose ARB. All right?
Yes.
Okay. We done this case. Anything you want to ask?
No.
No. Okay. Let's see the new one.
Yeah.
Let's see next one.
All right. So it's saying a female 65 years old with diabetes for 12 years, blurred vision for 3 months. Fundus examination reveals microaneurysm, a small amount of bleeding and cotton-like soft exudation. The patient's stage of diabetic retinopathy, is
sorry, this is 1. Stage. Stage 6. Stage 1, stage 6, stage 2.
I mean, 4. Okay,
4.
the other one should be.
This is 5.
So 1, 4, 2, 1, 5. Okay.
Yeah, this is 4. 1, 4, 2, 1, 5. Yeah. Probably.
So blood vision for 3 months. Fundus examination. Microaneurysm. A small amount of bleeding. Cotton-like soft exudation. Hey. Wow. So diabetes-induced retinopathy.
Yes.
So what type of stage?
Yeah.
Actually, I don't know the stages. But let me first just try. Small amount of bleeding. Small amount of bleeding. I will go for stage 2, phase 2.
Yeah. Okay. Let's see the answer. It's a little bit tricky. Directly out, we have this one. Ta-da! 1, 2, 3, 4, 5. First one is microangiopathy. Very clear, right? And then the second is heart exudation. And then 3 is cotton-like exudation. And then from the 4 is a new vascularization, which means they have the new vascular to grow up. And then fibrosis and the blindness. The last one is you couldn't see, just being blindness. Okay, the microangiopathy, heart exudation, and then cotton-like, which means soft exudation. And then new things happening, and then being fibrosis, and then the lung. Okay, so for this one, it's cotton-like. Cotton, which means soft exudation. Soft exudation, which means 3, should be 3. Let's say this 3. The patient fundus examination is a micro aneurysm, and then bleeding, stop the cotton-like exudation. So it's classic diabetes retinal change. So choose this question. Is C. C. Is this? Should be 3, I think. Wait a minute. Is this something very retinopathy? Yeah, it's 3. This should be 3, I think. Just remember the stages. This one is very important, right? Microangiopathy, which means small vascular being changed. And then we have exudation. And then exudation is, they have hard exudation and soft. Hard exudation and then soft colon-like exudation. And then number 4 is new. Number 5 being fibrosis, because the new vascular being fibrosis. And then number 6, the last step, we couldn't see anything. This is the step. For this one, they have cotton-like exudation. Cotton-like exudation is 1, 2, 3, 4, 5, 6. Here we have new, right? And vascular angiopathy, and then hard exudation and the soft exudation, which means cotton, and then fibrosis, and then blindness. Okay. Clear? Is it very clear?
Yes, actually, thank you for pointing that, because it's now easy to remember.
Yeah, it's very easy to remember now, right? Because you just see here, what's that? It's so many things. Just a point that we have the keyword here is more easier to remember. Again, we don't see anything. We just know the first one is vascular angiopathy, and then heart exudation. Heart exudation becomes soft exudation. Exudation is like cotton. And then new vascular here happened, and then fibrosis, and then blindness. Couldn't see anything. Finally, this retinopathy becoming the final step. Very good, right?
Yes.
Yes. Let's see the number 9.
Right, it says a 56-year-old. Okay, physical examination revealed that fasting blood glucose was 8 millimole per liter. 2 hours postprandial blood glucose was
Radio, which means after dinner, after meal, blood sugar, glucose.
Okay, yes. And serum triglycerides 4.5, low density lipoprotein 3.1, weight loss 5 kg in 6 months. Examination 160/100 and BMI 130. No other normal condition. Okay, so this patient preferred drug for lowering blood lipids is all right.
All right.
Yeah, I will go for statins.
BMI is 30. This asking how to lower the lipids, right? And then here we have several triglyceride, and then LDL 3.1, and then here triglyceride 1.5. Here we need to know which one to lower the lipids, which is more important.
Please, can you remind me again, what should be the normal value for postprandial blood glucose?
Oh,
like it should not, when it goes beyond what range that we should.
okay.
Because I forgot that. And even for the blood lipids too, you see that it should not be above 3.5.
Wait a minute.
Okay,
Let's clear about that. 2 hour. Oh, it's less than 7.8. Here, less than 7.8.
Okay.
Mm-hmm. Millimole per liter.
Yeah, I get.
So equals to 140 milligram per deciliter. Because this unit times 17, right? Almost same.
For this answer, I think I'll go with statins.
Statin. Mm-hmm. Yeah. The correct answer is statin. Usually we don't know anything, we just choose statin, right?
I just know it helps a lot with lowering blood lipids. But why is the best choice among all these ones?
Yeah, target is here. Which one is more important? We see the LDL is more dangerous here, and then how to lower the LDL? We see it's use studying to lower the LDL. TG is 4.5. Usually TG is more than 5.7. We lower it. It's a little bit high, but still not that high. We need to control. But LDL we need to control like lower than 2.6. 2.6 unit, which means millimole per liter is the target. And then here is a 3.1. Obviously, we need to target here is lower the LDL. How to lower the LDL is use statin. That's simple. Let's see the correct answer. They say a lot of things. 5 glucose, and then 2 hours later, normal value for TG is here is really low, right? And then here already 4.5 and then 3.1. Both of them are high, but first thing here is to lower the LDL is more important. Then first we gave statin because the patient is diabetes, hypertension, obesity, high risk of coronary disease. How to do the for prevent, we gave first trials is the statin. Sure again, A, B, C, D, statin. Both of them are high, but LDL is have a very bad effect, you know. HDL is good. High density lipoprotein, and LDL is low. This one have very bad effect for coronary vascular. To just make this what is clot more thicker and then thicker, and then HDL is to reduce them. So we need to lower the LDL to give statin. Let's see others. For example, fibrates the TG more than 5.7 to reduce the risk of acute pancreatitis. And then others don't have B. B don't have any effect. What is B? Vitamin, of course. This is vitamin, and vitamin nesting is for hypertriglycemia, mixed hyperlipidemia to TG, and this one reason is bile acid factor is suitable hypersemia mixed hyperlipidemia for TC. Okay, all others for TC, and then only the statin in for the LDL. That's why we choose the statin again here. All right, let's read the answer again. Anything? Oh, let's have a review. LDL 2.8 Tg more than 5.7 we gave favorites. Usually LDL gives steady. And for this case, LDL, the data is what? LDL this case is 3.1. This case is 3.1. So obviously it gave steady, right? Also, this patient is diabetes. We need to control it below 1.8 LDL. All right. This is the answer. Let's see next one.
So it's saying a male, 20 years old, he has a 10-year history of type 1 diabetes and takes intensive insulin therapy 4 times a day. In the past 2 days, I had fever, sore throat, loss of appetite, little food, so I stopped taking insulin on my own. In the morning, the family members found that the patient could not answer questions correctly and went to the emergency room. Temperature 35.5, 38.5, poor energy, slightly dehydrated. Laboratory tests, serum sodium 140, the serum potassium 4.5, blood sugar 25, blood pH 7.25, and urine ketones 3+ were present. The most suitable treatment plan for resumption of 4 subcutaneous injections of insulin therapy. Oh, okay. The most suitable plan.
For this option, right? A, B, C, D, E. Let's think about it. Urinary ketone. We have keyword here, right? And also, we already know they have type 1 diabetes. Type 1 diabetes is very serious type, which means out of control because this patient what? Stop the insulin by his own. Insane, right? Because it's just a 20 years old. Just a 20 years old just want to do anything they want. They just stop the insulin, right? Yeah, they're out of control because they're still teenagers. And then something happened very serious. They wouldn't answer correctly. Mental status as being different, go to ER. And then we have this temperature, high temperature, poor energy, and dehydrated. The sodium is okay because it's already usually 130 to 150. Serum potassium is 3.5 to 5. Yeah, it's okay. And the blood sugar is really high. Yeah, it's really high. And then pH. pH is usually 7.35 to 7.45. It's not okay. Ketone obviously is not okay. 3-star. You already know something happened to this
go
patient.
with insulin pump though. At least at each period of time it will be pumping.
Insulin pump, right?
Yeah.
This one. Okay. Okay, let's see the correct answer. Obviously, the patient have DKA, diabetes ketoacidosis. Because we see ketone here, right? Do you think it's ketoacidosis?
Yes.
Yeah, you see the pH 2.5. It's lower than normal. It's acidosis. And then we have ketone. Obviously, it's ketoacidosis. Type 1 diabetes, most common for the ketoacidosis. And also stop the insulin causes thing, consciousness, dehydration, high fever, because higher than normal. Urinary ketone, we can diagnose this DKA. And how to treat the DKA? This is the key things. Key DKA, ABCDE. First, we just see this review. Diabetes ketoacidosis, we gave very quick to rehydration, and then to slow start, and then give sugar. Fast, slow, salt and sugar, large amount of fluid, small doses of insulin, no alkaline. Supplementation, which means we need to give small dose of insulin. Which is small here. Small dose, no large insulin. Suction, injection insulin. High dose, not B. And we not subcutaneous because we need to give very quick. Subcutaneous is not quick because it will be slowly. And the intra-IV is very quick. And then small dose of insulin. That's why the correct answer is D. I think it's D, right? Correct answer is choose E. Sorry. Basal insulin subcutaneous treatment, right? Really? Basal insulin subcutaneous treatment. ABCD should undergo treatment as early as possible. Slowly. Yeah. Potassium should be based on usual is normal, so okay. Acidosis causes ketone body. After infusion, insulin treatment, the level decrease. Calcium supplementation. They say it's E, basal insulin subcutaneous treatment. Really? Okay, wait a minute. Let me find out what's the correct answer. No. The correct answer is this one. Intravenous low dose short-acting insulin therapy. This one.
Okay.
Yeah.
Oh, I see.
The correct answer is D.
What's reason again?
Reason again here is we need to give insulin very quick, which IV intravenous is very quick, and then low dose, small dose insulin. No pump is very slow. We need to quick to give insulin to lower the blood sugar, and then that's why we give intravenous low dose short acting insulin therapy.
I guess.
Yeah. Large amount is fluid. We gave large amount here. The high dose is not insulin. High dose insulin is dangerous. Small amount, but intravenous very quick. That's why we choose this one. Okay, we done for this PPT. Yeah, finally. Let's see a new PPT. Okay. endocrine, thyroid. This is the yesterday. I made 2 hours for thyroid. We finished about diabetes. We don't know a lot about diabetes, right?
Yeah, it was an interesting experience and journey.
All of them are new. Actually, diabetes we see very common in the hospital, even the outpatient or inpatient, but they have so many details, right? So after this, we already know a lot. So here is for thyroid. Let's see. Endocrine, thyroid, part. Let's see how many questions I prepared. The first one, second, third, 4, 5, 6, and 7, 8, 9, 10, 11. Yeah, 11 questions. We have 10 minutes left. Let's see if we can solve 1 or 2 or 3, right? Let's begin.
Yay. So a female 36 years old recently felt weak, intolerant of cold, pale, and gained 2 kilograms per year. Physical examination reveals second-degree thyroid enlargement, pain to touch, and edema for both lower limbs. Laboratory test hemoglobin 58. Urine routine showed red blood cells and urine protein 1 to 2. And no obvious casts. The most likely diagnosis is cold intolerance, pale, and then gained weight, enlarged thyroid, edema lower limb.
Very obvious from me because I prepared this.
I go.
Yeah.
He gained weight.
We have a keyword here, and then very quick.
Hey,
you find it, and you can give a keyword if we find out it, and then we have just 1 second to choose the correct answer.
Okay, I'll go for I'll go. Wondering if it's grave disease.
Hyperthyroidism, right? Unfortunately, this is not the correct answer. Okay, let's read it together. We have this kind of weak. It's of course you can think it's a hypothyroidism. It's not hyper. Hyper is they don't intolerant to cold. They feel like intolerant for heat. It's totally different. And then weight gain is also seems like the hypothyroidism. Second in degree of enlargement and then pain to touch. This is the key word. We directly go to the subacute thyroiditis. Only this one, remember? Subacute thyroiditis are pain to touch. And other things are just information give us. Nothing to help, just this one. We directly go to the subacute thyroiditis. Let's see the answer here. Histories after respiratory tract infection. No information, but swelling and then tenderness. Subacute thyroiditis, first hyperthyroidism and then hypothyroidism. They have a time. First it goes hyper and then hypo. Usually they have infection before, and this could be like some virus virus to cause something affect the thyroid. Here, both top the neck, right? And then the pain to touch is the key word. Next time you see, oh, it's very painful to touch the thyroid, it should be the subacute thyroiditis. And then also we see here is the hypothyroidism because it's already not this the first step, it's already the last step, hypothyroidism. Here, subacute thyroiditis inflammation probably caused by a virus. Virus. And then fever and thyroidiness and initial hypertension is common. It's hypothyroidism. Initially, which means the first step, they have hyperthyroidism and then followed by transient period of hypothyroidism. Diagnosis clinical and then function test. All right. This one, the correct answer for this question is D. D is true again. A, B, C, D. Here, right? Subacute thyroiditis. The patient is fatigue and cause sensitivity pile, complication, and then completion and then weight gain, body weight gain is hypothyroidism, all of them. Can see the hypothyroid. And then elderly patient with hypo neck examination is painless. But this one is painful when touched. That's why we think some inflammation happened, which means we choose D, subacute thyroiditis again. Right?
So,
yeah.
Okay, I was, let me see. So for cold sensitivity, mainly hypothyroidism. For heat sensitivity, mainly hyperthyroidism, right?
Yeah.
Okay, I confused that.
Hyperthyroidism, also the most common, actually this is the second question picture. And then we sweating, right? Graves' disease, have you ever heard?
Yeah.
Yeah, Graves' disease is one type of most common hyperthyroidism, which cause the patient sweating, remember? Goiter, exophthalmos, which means eye just enlarged, eyeball being staring at people. And this one is weight loss, nervous, and emotional insensibility, which means always want to fight with people, easy to argue with people. Next time you see someone always argue with people, maybe they have a hyperthyroidism. And a very thin, slim body weight, just a low body weight. Next time, maybe think it's the hyperthyroidism, Graves' disease, right? This is hyper.
Wow. Okay.
The opposite is hypo. The opposite one is this question is hypo. You see, cold. Obviously, cold, pale weight gain.
And then weight gain, right?
Yeah. You know, spring makes people very fuzzy and dizziness, and then like very tired. Do you feel tired?
Yes.
Yeah, I think it's kind of like hypothyroidism. And in the summer, people always sweat a lot, and then don't have any appetite, right? In the summer, appetite and then weight loss, and then because people don't want to eat and they have weight loss, it's kind of like summer they have hyperthyroidism. And then winter, people don't move because of cold, right? In the winter, the people don't want to move, and then they eat a lot. They have a body weight gain, and then pale and tired. And the winter, and then also spring, kind of spring, is hypothyroidism. This is totally different. Who will sweat a lot in the winter? No, because cold temperature. cold weather.
Please, can I see the explanation for the other answers? Why they were not?
As the others,
Okay.
hyperthyroidism, weight loss, wedding, metabolic system and system is no. Thyroid cancer is no. No cancer, surrounding tissue, cough, southern breath, compression, the trachea, hemoptysis, no. Hashimoto thyroiditis, they need to have the antibody, TPO antibody. Because Hashimoto disease, it is an immune disease, you know. Immune disease always they have antigen antibody to attack the cell, to attack the thyroid itself. So it should be data lab test. So it's not Hashimoto. It's also not cancer. Cancer, we have a tumor here to compress the trachea here, and then short of breath, and then blah blah coughing, and we don't have this thing. And hyperthyroidism, of course not. This is the opposite of hyperthyroidism. That's why we choose not cancer, not hyper, not Hashimoto, not hypo. It is subacute thyroiditis.
Okay, it makes sense.
Makes sense? No? Yeah. Of course it makes sense. I made this PPT. Here's subacute thyroiditis. They have maybe 3 weeks toxic, 6 week still toxic, then hyperthyroid. This is hyper. This is hypo being up. Hypo means T4, right? T4 being
Yes.
high and T4 being low, and then T4 being normal. So let me see, TSH stimulate the T4. So T4 high, the TSH is opposite. It's being low and being high and back to normal. So let's see when they recovery. End of the 18 weeks, 4 months. 4 months they can be in recovery. First 1 to 2 months hypothyroidism, and then 2 to 3 months they being hypothyroidism, and recovery, and 4 months. Very good picture, right?
What is again that's RAIU standing for? And then the recovery after 4 months is like how can I say, self-immediated or under treatment?
What under treatment? Oh, the treatment of subacute. Okay, very good. Wait a minute. Because it's a virus infection, usually they will subacute thyroiditis treatment. This is one of the question, right? Because it's what virus infection, so we need to do is reduce the pain and then treat hyperthyroidism. So when it's hyperthyroidism, we treat hyper. When it's hypo, we treat hypo. But how to reduce the pain is use aspirin and then ibuprofen. Use to control pain. And reduce the symptom. All right. Another question is, what is RAIU, right?
Yes.
RAIU